morning everyone, welcome back my YouTube channel. So in this video we just discuss about the blood collection tube. Okay, so there are different kind of blood collection tube. Okay, if you are going any clinical posting, that time you definitely withdraw the blood, okay, and filled in different vial or a different tube, sorry. Okay, so there are different kind of blood collection tube according to the color coding. Okay, so having different purpose. Okay, if you want like ESR or a complete blood test, CBC test, most common, that time you just used lavender color tube. Okay, if you want like biochemistry test like LFT, KFT, or a lipid profile test, or like any immunological or serological test like BDAL test for a typhoid patient, or a HIV test, or a hepatitis test. Okay, so that time you just filled in red tube, or a red tube having various tests like if you want any hormonal test like for a thyroid test, T3, T4, and TSH. Okay, you just filled in red tube. Okay, so I just give a brief idea about the blood collection tube. So each blood collection tube according to the color coding having different purpose. So in this video we just discuss. Okay, so let's start the video. So first we discussed gray tube. Okay, gray tube look like this. Okay, this is a gray tube. For a gray tubing, mainly for a glucose or a lactic testing. Okay, there are two additives are used like sodium fluoride, in here also written. Okay, sodium fluoride basically act as a glycolysis inhibitor. Okay, glycolysis means breakdown of glucose. You already studied in class 12th. Okay, so glycolysis inhibitor, so it can easily detect glucose present in blood, so you have to use sodium fluoride. Yeah, okay. And then potassium oxalate act as an anticoagulant, so it can prevent clotting of the blood. Okay, so in gray tube, most common test you have to done like blood glucose test like FBS, fasting blood sugar, PPBS, postprandial blood sugar, RBS, random blood sugar. Okay, GTT means glucose tolerance test for a diabetes patient. Okay, or a lactate or a lactic acid test to measure tissue oxygenation. Okay, in case of shock or sepsis patient. Okay, blood alcohol level or a ethanol test, you have to do a gray tube sample. Okay, I hope you learn about the gray tubing. Okay, so what kind of test you have to done for a gray tubing? You definitely said. Okay, G for gray tube, G for glucose or lactate test. Okay, now we discuss different like lavender tubing. Okay, lavender means purple cap tube. Okay, so in this tubing used additive like EDTA, like ethylene diamine tetraacetic acid. You just remember full form of EDTA. Okay, so EDTA mainly anticoagulant, so prevent clotting of the blood. Okay, so EDTA are two types, K2 and K3. K2 mainly present in liquid form and K3 mainly present in powder form. Most common used EDTA is K2 because they are present in a liquid form, so easily dissolve and for a better result. Okay, so you can use K2 EDTA mostly. Okay, so most common test done in lavender tubing, CBC, complete blood count, ESR, erythrocyte sedimentation rate that can indicate inflammation. Okay, peripheral blood smear that can identify the cell morphology, cell structure. Okay, HbA1c, glycosylated hemoglobin used for a diabetes patient. Okay, reticulocyte test for a bone marrow activities. Okay, or a blood grouping or a cross matching sometime. Okay, mainly in pink vial or a pink tube. Okay, I hope you learn about the lavender tubing. Okay, if you want ESR or CBC, that time you just fill the blood in lavender tube and send for a test. Okay, and then you just discuss red tube. Okay, this is a main tube. Okay, if you want like various kind of test, you just fill in red tube like used for a serum sample collection. Okay, additive or a composition are used for a red tube. Red tube are mainly two types, plain red tube or a clot activator tube. Okay, plain tube having no any additives, please remember for a MCQ. And clot activator tubing using silica particles for or thrombin. Okay, mechanism: when blood is drawn, it clots naturally in 30 to 60 minutes and then centrifuge and separate serum from the clots. Serum is basically used for a biochemical or a immunological testing. Okay, serum means liquid portion of clot blood. If blood is clot, that time liquid portion like yellowish in color is known as serum. Okay, so common test done in a red tube, of course we have to discuss in intro. Okay, biochemistry test, glucose, urea, creatinine, electrolyte, LFT, RFT, lipid profile. Okay, for a serological or a immunological test like vital test for typhoid patient, HIV, okay, hepatitis, okay, HbSAg test we have to done. Hormonal test like T3, T4, TSH, insulin, cortisol. Okay, for a blood banking, antibody screening we have to do. Okay, so that time you just fill the red tube and go for a test. Okay, light blue tubing, this is light blue tubing. Okay, primarily used for a coagulation. Okay, if you like MCQ is most common, like if you want coagulation or a clotting test, then what kind of most common tube are used? Light blue color. Okay, so additives are used, most common additives, sodium citrate. Formula is Na3C6H5O7, act as anticoagulant. Okay, so prevent the blood clotting. Okay, most common test done in light blue tube, PT, prothrombin time, INR like international normalized ratio, or APTT, activated partial thromboplastin timing, or TT, thrombin timing, D dimer test, or a fibrinogen level. For MCQ you just remember. Okay, mainly you just remember prothrombin timing or thrombin timing. Okay, light blue tube. Okay, and then yellow tube is not there. Okay, so yellow tubing you just know, like cap is yellowish in color. Okay, yellow tube is basically two types. Okay, so yellow tube with SPS, like, okay, SPS means sodium polyamethol ethyl sulfonate. Okay, act as an anticoagulant or a preservative. Okay, preservative means inhibit phagocytosis, means in blood having present bacteria. Okay, so it can just prevent, not destroy the bacteria. So you can grow in a culture medium and detect which kind of bacteria are present in blood and how is it to grow in the blood. Okay, so you can know the mechanism of bacteria. Okay, so common test for a blood culture like aerobic or anaerobic. Okay, septicemia, like infection occur in the blood, or a sterility test, that time you just used yellow tube with SPS. Okay, SPS means sodium poly and ethyl sulfonate. Okay, so when you have to use yellow tube with SPS, if patient having high fever with chill, or a suspected sepsis, or ineffective endocarditis, or pyrexia, we don't know the reason. Okay, so in short, if patient having any infection related symptoms, that time you just used yellow tube with SPS. Okay, yellow tubing with ACD tube. Okay, ACD means acid citrate dextrose A and acid citrate dextrose B. Okay, mainly ACD like to prevent calcium from participating clotting. Okay, so this tube are used for a DNA or a genetic testing, for a DNA extraction, or a molecular or a genetic test. Okay, or some basic test like HLA typing for organ transplantation. Okay, you just read. And then most important, golden tubing, most are not using, mainly used like for, okay, for tube, red, gray, light blue and lavender colors are used mostly. Okay, golden tube are used for a SST tube. Golden tube is known as SST tube, means serum separate tube. Okay, there are two additives, clot activator, okay, and gel separator. Like for a gel separator you have to use thixotropic gel. Okay, golden tube mainly used in biochemistry test. Okay, biochemistry test you have to also done in red tube, but but main used for a golden tube for a biochemistry test. Okay, there are various kind of test you have to done. Okay, okay, like most common test, LFT, KFT, lipid profile, thyroid test, hormone test. Okay, or vitamins test, or a serological test like HIV, okay, HbSAg, or hepatitis. Okay, gel separator, mainly during centrifugation gel rises and forms a barrier. For MCQ, if centrifuge, then seal will be placed in bottom, middle part will be the gel, and upper part is for the serum. Okay, so this is the common things, and then you just collect serum from upper part and then do the test. Okay, this is the golden tubing, and in the last we just give some important MCQ. If you want like CBC or a hematology test, then which kind of like blood tubes are using. Okay, so for a CBC you just use lavender color. I hope you just understand my video. So if you understand my video, then please answer in my comment section. Okay, like which kind of blood tubing are used, blood collection tubing are used for a coagulation study or a blood culture or a glucose or a cross matching. Okay, for a cross matching just give answer pink. Okay, so I hope you can understand my video. If you have any doubt, please comment. Okay, if you want like making a new video on your personal choice topic, so you just suggest your topic in comment. I can make a video on your topic. So हंसते रहिए, मुस्कुराते रहिए, मिलते हैं अगली वीडियो में, तब तक के लिए हैव अ नाइस डे।